Welcome back. You're still watching the Afia Morning Show. Thank you for staying with us. Now we take regional stories beginning in the state where, well, there is a saying that health is wealth, and being in good health enables individuals to carry out their daily activities with ease. However, for those living with the human immunodeficiency virus, maintaining good health can be a significant challenge. Against this backdrop, the Office of the Wife of the Enugu State Governor, in a collaboration with Custos Care Foundation, inaugurated the Red Ribbon Initiative, a program designed to support people living with HIV and help them lead fulfilling lives. Afia TV correspondent Chidimma Madu now reports.
The event serves as a platform for shared knowledge and meaningful engagement on how to improve the lives of individuals living with HIV. Stakeholders who narrated the experiences of those affected revealed some of the challenges they face, including stigma, lack of adequate counseling, poverty, limited access to healthcare support and medication. They also identified key areas where government intervention is urgently needed.
Enugu State has an anti-stigmatization law. That law needs to be reviewed. How that the law was written before, now there are certain things that need to be expunged and there are some that needed to be added. Yes, we are pleading that you help for you to help us to make sure that there are more mental mothers, one, to be trained, that will be taken to different facilities and equally to the TBAs that control better attendance in the community. Because most of these TBAs, one, they are afraid of HIV testing. Most of them have not gotten that fully idea of the testing. But the mental mothers, if they can be empowered more and send their maybe attached to different TBAs, it will equally help to make sure that any pregnant mother that visited that TBA, the proper screening and pure follow-up will be given to that woman. If at all that the woman is HIV positive, they will equally follow the woman up to make sure that the child, because that's the target, is HIV negative.
The program featured interactive sections and discussions on health management, managing side effects, strengthening the immune system, and conducting overall body assessments. One major concern raised was the declining rate of HIV awareness campaigns, which has contributed to the recent rise in infections. This underscores the urgent need to bridge the knowledge gap by intensifying public education about HIV through various media channels. The importance of abstinence was also emphasized, especially among women of childbearing age, who are particularly vulnerable to HIV infection due to the biological nature of their genital tract.
We preach abstinence. It is very key. The moment you get to that childbearing age, it is presupposed that you have enough information as to be able to take charge of what happens to your body. For the young people, no means no. The Federal Ministry of Health, in partnership with the Enugu State Government, the State Ministry of Health, and some of our partners, Caritas, notably, have ensured that no individual pays for the HIV testing. There are 3 tests that will become free for all individuals, especially women of childbearing age. HIV, hepatitis B, as well as syphilis, because these are the scourge that threatens the existence of womanhood. So if you know of anyone that might need to know their status, please walk into any primary healthcare center and get your tests done. We also have treatment sites. Treatment sites are dedicated sites that ensures comprehensive treatment of people who have the virus. In those treatment sites, we are also emphatic about our pregnant women who are HIV positive. Our aim is to ensure that they do not pass on that virus to their unborn child. This is a forum where we are giving visibility to a hidden truth. And I am particularly pleased with the First Lady of Enugu State because this is an uncommon venture to be able to give visibility to people who have this virus, who have been termed the voiceless is something that prosperity will indeed judge you kindly.
The wife of the Enugu State Governor, Mrs. Chidimma, reaffirmed her commitment to addressing the issues raised during the program. She assured participants that her office, through her foundation, will take active steps towards supporting people living with HIV. She also called on other stakeholders to partner with her office in tackling these challenges.
Instead, we are here to share authentic stories, true and real stories of individuals living with HIV. These narratives of survival, strength, hope, and triumph against the odds are vital to our collective journey. Living with HIV can be a daunting path, but it is not the end. It is a journey that many have navigated with bravery, resilience, and unwavering determination. I want to reassure all of you that receiving an HIV diagnosis is not a death sentence. With early diagnosis, advancements in treatment, access to necessary care, and the love and support of family, leading a long, healthy, and fulfilling life is not just a dream, it is entirely possible. Here in Enugu State, we are dedicated to ensuring everyone receives the care and dignity they deserve. However, we know that treatment alone is not enough. We must confront the stigma, the harsh words, and the unfounded fears that persist. We must create a society that uplifts people rather than relegates them to the shadows. To those living with HIV, I want to say, keep striving, keep showing up, believe in your inherent worth, live responsibly for yourselves and your families, children, partners, and communities. Your dreams and aspirations are still important.
Stakeholders concluded by encouraging members of the public to know their HIV status and emphasize the need to end stigmatization. They reminded the public that people living with HIV can live healthy, productive lives with the right support and care. In Enugu, Chidimma, Madu for Afia TV.
Thank you, Chidimma, for that report. And that's a great one from the office of the First Lady of Enugu State, or rather, wife of the Enugu State Governor, Mrs. Chidimma, and of course, Custos Care Foundation, prioritizing the needs of people living with the virus and making them feel and understand that Enugu State does not stand for any kind of stigmatization whatsoever. It's a great one. What do you think, Oji?
Yeah, it's awesome that they're seen and heard and all that, and that's accompanies them to, yes, it's one thing to be a victim of this, but the thing is, how is society, collaborating to help and not stigmatize these individuals, right? So, bringing them in and making them feel that part of society would, also ameliorate whatever the issue is, like the stigma and stigmatization, and also making them feel that they are part of us. They are still human. No matter what happened or whatever, they're still human. They're part of us. And also, this engagement is very important and salient.
Right.
That the wife of the governor and also the society, they are bringing forth this and getting these people to be part
of the society. It's important that we also state very strongly and clearly that living with HIV is not a death sentence. And I think that's what this Red Ribbon Initiative hopes to enshrine in the minds of Enugu. And that's a great one once again from the wife of the Enugu State Governor in collaboration with Custos Care Foundation.